Hello, my name is Lisa. I'll be your nurse today. Could you tell me your name and what brings you in here?
My name is Benwin. I'm 31 years old. I don't know what happened, but I just cannot breathe. Especially when I lay down, I feel my heart beat really fast, and I feel anxious, tired all the time. I sweat and cough a lot. My chest is hurting too. And then when I cough up blood, that's why my family brought me here.
You have the symptoms of acute heart failure. Some symptoms of chronic heart failure would be dyspnea, fatigue, edema, weight gain of more than 2 pounds in 3 days, and restlessness, confusion, and chest pain. Do you smoke or drink alcohol?
Oh yes, I do. I smoke like the last 7 years, about half pack a day, and I drink alcohol occasionally, about 1 or 2 times, like every 3 months.
Could you tell me something about your past medical history?
Well, I got diagnosis with hypertension, hyperlipidemia, and coronary artery disease 4 years ago. And in my family, my mom actually had hypertension and coronary artery disease also.
Okay. Some risk factors for heart failure include coronary artery disease, advancing age, hypertension, diabetes, obesity, and hyperlipidemia. Oh, Dr. Oak.
Oh, hi, Lisa.
Hi, I was just wondering if you had seen Miss Wynn's assessment earlier today.
No, not yet. How'd that go?
Things are okay. She's been experiencing some tachycardia. Her respiratory rate was 30 breaths per minute. She has some cool, clammy skin, and I also detected some crackles and wheezing. What do you think this sounds like?
We can't go just off of her signs and symptoms, but it sounds like it could be some heart failure.
Okay. Could you give me some more information on heart failure?
Yeah, sure. So pretty much just an abnormality of the cardiac function of the heart's ability to fill and or pump blood. So what happens a lot of time is the heart fails to pump enough blood to be able to feed all of our body what it needs to be able to metabolize in the tissues. Or if it does do that, it's at an elevated diastolic filling pressure. It's also further classified into systolic or diastolic failure, or both. So, it used to be known as congestive heart failure, but the terminology preferred today is just heart failure, just because not everyone has the congestion or the fluid overload.
Oh, okay. Are we going to have to run any diagnostic studies on this one?
Yes, absolutely. Because the signs and symptoms aren't just specific to heart failure, they actually correlate with a lot of other diseases. So what we're going to do, we're going to get a measurement of her heart using an endocardiography or nuclear imaging. We're going to take her B-type natriuretic peptide levels. What this does, it's also known as BNP. What it does is it correlates positively with the degree in the ventricle dysfunction. And then we'll also need to get her ejection fraction. What that does is it differentiates between systolic and diastolic heart failure.
Okay. Well, I guess once you put in the order, we can go ahead and get started on that.
Sounds good. I'll do that right now. The test we ran earlier on your heart, the results came back, and you're having some acute heart failure. So, but don't worry, we're going to take good care of you. Let's see. So what we want to do with the treatments here, we want to treat your underlying issues that you have, so like your hypertension and your heart rate and everything's elevated. So some goals we want to achieve would be maximizing your cardiac output. We want to alleviate your symptoms, obviously, and then also improve your ventricle function. That's really important.
Okay.
So how we're going to do that, I'm going to go ahead and put you on a sodium and fluid restriction, okay? So try not to eat a whole lot of salty foods, and don't drink excessively, because we want to get all the edema. We want to reduce that to reduce the stress on your heart, okay? I want you to take it easy. Don't do anything too strenuous until we get this under control. And I also want you to take a special note of your weight gain. If you notice that you gained 2 to 3 pounds in only a couple of days, you definitely need to let us know, okay? So some drugs that I'm going to put you on. I'm going to give you a diuretic. This is going to help with the fluid retention, and let's see, I'm going to put you on a vasodilator. It's just going to open up your arteries and everything and lower your blood pressure. Want to put you on anticoagulant. So once again, that's just going to help with your the blood pressure. Going to put you on a beta blocker. This is just going to reduce the stress on your heart, and also some digoxin. So this is just going to decrease your heart rate. Okay. Do you have any questions for me?
Oh yes, I do. So besides all the heart problem that I'm having right now, is there anything else can be affected in my life by heart failure?
Well, you do have the pulmonary edema, as Lisa had mentioned earlier, the crackles in your lungs. Also, you can have some sleep apnea. Have you been feeling irritated or agitated, maybe fatigue?
Yes.
Okay, yeah, that's probably you're not getting good sleep. And then also it can lead to some anemia, so we'll probably check your iron. Let's see. What about, have you been feeling any anxiety, depression lately?
Yes.
Okay, yeah, it can take a toll on your emotional well-being. How about socially? How are you withdrawn lately?
Yes.
Okay, yeah. So all of those things can be affected by heart failure, so, but not to worry. We'll get you back to health, and you should go right back to normal.
All right, thank you.
Okay, thanks.
Hello, Miss Lynn. I saw that you guys talked to the doctor. Do you have any more questions?
Oh yes, I do. Is heart failure really common?
Well, actually, about 5 million people in the United States have heart failure. 470,000 new cases are diagnosed each year. Heart failure dramatically increases with advancing age. Approximately 1 in every 100 older adults has heart failure. The incidence of heart failure is similar in men and women. African Americans have a higher incidence of heart failure, develop heart failure at an earlier age, and experience higher rates of mortality related to heart failure than whites. It also tends to run in families. Is there anything else?
Oh yes, I'm really curious then. So how can I prevent the incident to occur again?
Well, the best way to prevent the progression of heart failure is to control your risk factors. This would include treating your coronary artery disease, treating your hypertension, your hyperlipidemia, if you had any diabetes, and also for cessation of your smoking. Some lifestyle changes that you may need to make are exercising, reducing your salt in your diet, managing your stress, treating your depression, and especially losing any weight if that's what's been causing it.
Oh yeah, so you know what? I live by myself, my family not around, so is there any suggestion that you can give me to get, emotional support?
Well, I would highly encourage you to find either a friend or a healthcare provider who you can share your emotional and stress needs with, and they can help you with therapy. Also, it's important to share your points of view, and also to find functional help. So this would include your activities of daily life, finding either an organization or a person to help you with the tasks of everyday life.
Oh, okay.
Some goals of your rehabilitation are for you to experience a decrease in your symptoms. This would be your shortness of breath and your fatigue, a decrease in any edema or any swelling that you've been having, an increase in your tolerance of activity, and compliance with your medical regime. It's very important for you to continue the use of your medication. Even if you become asymptomatic and you don't have the same symptoms, we really encourage you strongly to continue using your medications. Some modifications that you may need to make in your life are to conserve some energy in your daily activities. You may need to rest after activities. It's also important for you to stop smoking and any weight reduction if you've been having that problem. It's also important to decrease sodium content in your foods and to eat smaller, more frequent meals. It's important for you to increase your walking and other activities, but gradually. What we'd like you to report immediately to your healthcare provider is if you've been experiencing difficulty breathing, waking up breathless at night, any fatigue, dizziness, or weight gain of 3 pounds in 2 days. And we'll also need to continue your appointments with the doctor. All right. Well, are there any more questions?
No more.
Okay.
Thank you.
Well, it's been a pleasure to be with you.
All right,
Goodbye.
thank you.